Welcome to Medically Speaking. My guest today is Don Boyd, the President and Chief Operating Officer of Kaleida Health. Don, thanks for joining us today.
Thank you, Mike. I really appreciate the opportunity to connect with you today.
So we wanted to chat about COVID-19 and where we are as we've turned the calendar to 2022 and as we head to the end of January. If you can briefly, just give us a snapshot of where we are organizationally and what the community is facing with COVID-19 these days.
Yeah, thank you, Mike. So we've seen a lot of change even within the last week relative to COVID-19. So significant drop in our inpatient admissions. As of today, there's 185 individuals in the hospital when there was just 240 a week ago. So what we're seeing is a decrease in the positivity rate in the community, a decrease in the positivity rate in our staff, and all that's translating to fewer inpatient admitted patients at Kaleida and across the community. So we think we're turning the corner in this most recent wave of COVID related to the Omicron variant.
So this latest round of COVID-19, or even through 2021, was not short of any challenges in terms of what you had to deal with. If you can, talk a little bit about some of the staffing challenges that you were faced with, or that the industry was faced with, and how you handle that in battling the surges of the pandemic.
Yeah, the fourth quarter was an interesting one in Western New York. So confluence of events. We had the workforce interruption at Mercy with the strike, which reduced the number of staff beds in the region, putting more pressure on all providers. Then you had the federal and the state mandate for the vaccine. And so we did, unfortunately, see some people choose to leave the profession. And then on top of that, with the increase in travel reimbursement for agency nurses, we've seen staff choose to go pursue those opportunities. So the team's done a great job in planning and in response to that, and being able to work with the governor and with the Department of Health to secure some preferred staffing relationships to bring more agency staff in to the organization to provide short-term stability. We also partnered with labor during that time to utilize our collective bargaining agreement to provide additional incentives to staff who were willing to pick up more time. And then we did all of that while we're also working on redesigning our HR processes to get people into the organization faster, and a full court press on recruitment of additional nurses and assistive personnel through our partnerships with the schools, and introducing referral and sign-on bonuses for potentially new staff.
Let's also talk a little bit about the challenge of the mandates that the industry was faced with. So the vaccine mandate and now, dealing with the booster mandate. How did you guys deal with that from an operational perspective? What were some of the challenges, and how do you see this moving forward?
Well, first of all, I want to thank our staff and our providers, because the response from our staff to the call to receive a vaccine for those that maybe previously had chosen not to, or had sought a medical or religious exemption, was overwhelming. I think at the time that the first mandate was in place at the end of September, over 98% of our staff had chosen to be vaccinated. And then those that didn't, by the end of December, ultimately did. So we had less than 1% of our workforce, Mike, that chose to not get the vaccine and then separate from the organization. So I really want to thank our physician and our providers for making that decision. I know it's a personal choice that each person had to make, but protecting themselves and then making themselves available to be able to care for the community through that decision meant a ton to be able to help us navigate this most recent increase in COVID cases while we were securing additional agency staff to support them.
What do you attribute the high acceptance rate of the vaccine and now the boosters that's come along? Is that just the workforce and their passion for the job? Is that the passion to protect patients and their coworkers? What do you attribute that to?
So a number of things, and you hit on the first one, passion. I think people that are drawn to work in healthcare, there's a certain DNA that they have about being committed to care for patients, and so I think that was the first choice. I think education and educating themselves. We also did a fair amount of education and work to provide information through our physicians, through infectious disease, and through employee health. And then I think also the sharing of information, in partnership with the Department of Health and with the governor and with labor about the importance of vaccine, all contributed. But really, the staff and the providers deserve the credit for doing the research, becoming informed, and then making the choice to become vaccinated.
You mentioned some of the volumes earlier and how they're trending downward. Vaccine mandate, staffing shortages, but increase in volumes at one point became a challenge for you organizationally, in particular elective surgeries. If you can, describe what the process was handling that on a day-to-day, week-to-week basis in terms of can you not do elective surgeries, or how do you prioritize what types of surgeries get done?
Sure. Well, we've talked before about dual systems of care, right? Designing the ability and the processes and the resources to be able to take care of rising COVID cases while also caring for the other patients that rely on us every day, including our surgical patients. So we've got great partnership with our physicians and our leaders and our surgical executive committee at each of the sites, who would come together with nursing and operational leaders to literally review every case in advance of those cases being scheduled or proceeding on the schedule, and looking at that with our data about the number of patients that we had in the hospital, what our projected staff beds were, so that we could confidently and safely make the decision on which cases we could proceed with. And that's a process, Mike, that we've been doing throughout the waves of COVID, with or without, a surgical moratorium in place from the Department of Health. So kudos to the physicians and to the operational leadership that goes through that and continues to do that today.
So we're entering year 3 of COVID-19, and again, volumes are trending down. And you mentioned dual systems of care. Is this something that you guys, as an operations team or organizationally, we see as something that we're just going to have to deal with for the foreseeable future in terms of living in these two worlds?
We do, and whether it's COVID or whether it might be, we use these same principles when we had our weather event, right? So the ability to forecast, the ability to plan, the ability to look into the future as far as you can, and then appropriately have the right people, process, and technologies in place. So whether it's COVID, Mike, whether it's a weather-related event, or whether it could be a surge in RSV cases next year at Children's, we do think having this rigor, this discipline, this structure and framework in place is critical to our success now, but in the future to adjust to any changes in operations we might see.
Yeah, we talked about recruitment earlier and some of the challenges with staffing, but moving forward, or taking a forward-looking position here, what's your message for those who may be interested in healthcare or nursing, allied health, maybe the technical side of it? It seems like there's going to be a huge opportunity in the next 2, 3, 4, 5 years for the workforce as this generation retires out or moves on to other things. It seems like there's huge opportunity here.
There's tremendous opportunity and there's tremendous need, Mike. So, there's been a lot written and talked about the Great Resignation, about individuals for a variety of reasons who are just choosing to pursue different elements of and opportunities of career. And so there's a great opportunity in healthcare. The impact and the difference that an individual can make as part of a care team in providing care to this community. And you look at what they've done over the last 20 months and providing tremendous care to the Western New York community. It takes special people, it takes special talent, it takes committed individuals that believe in the greater good of providing care to your community, to your neighbors and your friends. And there's going to be tremendous opportunity, there's tremendous need, and there's great opportunities to grow a career, not just have a job, but grow a career in healthcare, regardless of where you start in the organization or what educational background you have or what your training is. And there's great career paths within Kaleida Health that people can avail themselves of. And so a lot of focus and effort on recruitment and engaging in the schools, engaging in the community, engaging in maybe some non-traditional areas of the community to really help people understand the difference they can make in not only their own life, but in the life of their community by working at Kaleida.
I'd be remiss if I didn't ask you. I know we're focused on COVID-19, but you do have an organization run day to day in terms of hospital operations and home care and long-term care, physician operations. If you can, just give us a snapshot of what you're looking forward to for 2022 in terms of organizationally and some of the things you're focused on.
So one of our short-term areas of focus, and we've laid the foundation for that in 2021, is really around our ambulatory growth and ambulatory growth plans. And so tremendous amount of work and effort's been put into really understanding and studying the market, studying the opportunities to grow through the creation of new ambulatory access points across the community. So having care be provided closer to home where people live and work and play. And so we'll be completing some further analysis of those opportunities. And related to that is also the physicians and the providers that are necessary to be able to capitalize on those growth opportunities that we see. So if we think about 2021 as of really stabilizing, post COVID, really look at 2022 as an opportunity to grow, and in particularly grow in the ambulatory space in 2022 in partnership with our physicians and in creating new growth and access points in different areas of Western New York.
That's great news. Something to focus on besides COVID-19. As we wrap up, a message from you to the Kaleida Health workforce or healthcare workers in general across Western New York.
We say it often and we can't say it enough, and I'll say it again. Just tremendous gratitude, tremendous thanks, tremendous pride in what the entire team, providers, nurses, staff at Kaleida Health have done. It's been a long 20 months, but the resiliency, the perseverance, the professionalism, and just the passion that people. I have a story every day that I could tell about an interaction with somebody about the difference that they've made in the life of someone in our community, and that's just very special and needs to be continued to be recognized and talked about. And I appreciate you asking so that I could share that message with the team.
Yeah, it's great to hear the passion and the gratitude for the workforce. Don Boyd is the President and Chief Operating Officer for Kaleida Health and the point person for COVID-19. Don, thanks for joining us today.
Thank you, Mike.